we did a survey. We performed a survey on patients with MPN to try to understand the impact that the COVID-19 pandemic has had on them. There is not a lot of, although there's increasing data in terms of outcomes of these patients, we wanted to understand how patients with chronic disease would experience this illness with regards to their medical care, as well as just their day-to-day life and symptom burden. And this is a fairly well-studied population. So we do have data with regards to some quality of life. So it was a very good opportunity, I think, to try to look and see what happens to them in the setting of this pandemic. So we asked many questions. The survey was created. Through a red cap system, and it was distributed through an MPN quality of life website. And so patients all over the world had access to it. We asked questions about their symptom score. We asked about the NCCN distress thermometer. We also wanted to ask the impact on their medical care, including their access to providers, different implications on their treatment, as well as using questions from a CDC COVID-19 community survey question bank regarding the impact of COVID-19 on any population, actually. We wanted to understand some of their baseline features of their disease, including what was their MPN diagnosis, as well as medication status, whether they were in a community that had a stay-at-home order, what the degree of community spread, or at least perception of community spread was, as well as the country that they lived in. And so when we looked at, there was 1,217 evaluable patients for response, and they were fairly evenly distributed between the three different types of myeloproliferative diseases, as would be expected based on the prevalence in the population. So about a third of them had polycythemia vera, almost half of them had essential thrombocythemia, and about 20% had myelofibrosis. In terms of some of their, in terms of where they were from, 43% of them were from the United States, 41% were from the UK, and then there were some from multiple other countries such as Australia, Canada, Ireland, Netherlands, and then there were other countries as well, and a smaller percentage. We did ask about chronic diseases, and 13% of them had asthma. About 10% of them had some form of immunosuppressive condition, which possibly related to their underlying myeloproliferative disease. And then a much smaller percentage had chronic lung or heart disease or diabetes. With the respondents, about almost all of them, 84% of them, were on some form of medication. 15% were on ruxolitinib, 15% approximately were on interferon, 42% were on hydroxyurea, and about half of them were on aspirin. Interestingly, only about 5% of them had an actual change in their MPN therapy based on this COVID pandemic. Over half of them were actually utilized telemedicine. About a third of them reported that they had to increase the time between their visits with their MPN provider. Only 119 of them, so about 10% of them, had respiratory symptoms. Only about half of them actually sought medical attention for this. Interestingly, 13% were tested for COVID, but only 5 patients actually tested positive for COVID-19 in this time period. And this was done, this survey was performed actually between June and July of this year. So it was well into the COVID pandemic, at which many patients in America had probably been through areas that had waves of COVID, as well as the UK, from which the majority of the respondents were from. In terms of the impact on daily life, as would be expected, the majority of them reported some impact on their daily life. Interestingly, about 60% of them reported that they didn't have any financial difficulties, which is higher than I would have expected. The majority of them wore face masks in public places, and as would be expected, the majority of them reported some form of stress because of the social distancing. We also sought to look at coping habits that were employed, and patients in general seemed to employ fairly good coping habits. Only a small percentage, about 12%, reported drinking more alcohol. About 40% reported eating more sugary foods. But in general, we did not see a lot of really negative behaviors. So what we wanted to see what factors impacted the distress thermometer as well as the MPN-TSS. And what we found is that the stay-at-home order actually impacted the MPN-TSS score. And we looked more carefully at it and tried to identify which aspect of the MPN-TSS, which factor, whether it be fatigue or the constitutional symptoms, spleen-related symptoms. And fatigue seemed to be a little bit higher, but was not statistically significant higher. So almost all of the symptoms that they experienced seemed to be experienced a little bit higher if they had a stay-at-home order. The country of residence, if they were in the United States, they had a higher NCCN distress thermometer as compared to other countries. And the perception of community spread also seemed to affect the reading on the distress thermometer. There's a few things that were fairly notable about our study, that at least in this preliminary form. I think, first of all, it is one of the first studies that's been done using a population with chronic disease and a fairly homogeneous population with chronic disease. It is very notable that a very low number of them were actually diagnosed with COVID-19. This is actually not as surprising in looking at the data and looking at some large series from Europe. Looking at both in Italy, looking at CML as well as MPN patients, a very, very small percentage, lower than would be expected, were actually diagnosed with it. Now, whether this is something to do with their underlying disease versus that they were just more careful in terms of their following the proper precautions, it's not clear. We also noticed that there was a high use of telemedicine, and there is another abstract that was presented at the meeting in poster form looking at some of the experiences that patients have had with telemedicine. That was presented using data from our survey, looking at more of the patient comments on it that has some more insight into what their experience was with that. And I think the impact of the different variables in terms of the MPN-TSS as well as the NCCN distress thermometer were also fairly interesting. I think the MPN-TSS in terms of the stay-at-home order was likely that they were at home, probably had some more depression just because of the fact that they were stuck at home. And we do know that depression can impact the way that patients experience, or that can impact the MPN-TSS scoring. The distress thermometer makes sense in terms of the prevalence of community spread, and with some of the political upheaval going on in the United States, that might explain the reason why patients in the United States had a higher perception or higher distress thermometer reading than the patients outside of the United States. I think this survey provides some very useful baseline data to try to understand how people perceive this. However, clearly more work is needed to understand the long-term impact of this. Future plans include actually repeating the survey at a later date, at which point we would potentially will see a higher rate of patients who are exposed or potentially were COVID positive, especially as testing has been far more available, but also understand some of the effects of the long-term impact of this pandemic on patients with chronic disease.